Hi, I'm Dr. Agarwala from Panorama Orthopedics and Spine Center. I was born in India, but came here when I was very young and grew up mostly in St. Paul, just north of Minneapolis. My winters here in Denver are a lot of fun because I love heading up to the mountains and going skiing, snowshoeing, backcountry skiing are all great joys of mine. And then in the summer, my wife and I both love to go mountain biking, backpacking, so we definitely spend a great deal of time up in the woods and up in the mountains. So I did my undergraduate at Johns Hopkins University, and that's where I was a biomedical engineer and did some of my materials research in orthopedic implants. Then I went to medical school in St. Louis at Washington University, and then I went to Albuquerque, New Mexico to do my trauma orthopedic residency, knowing that there was a great deal of orthopedic injuries in New Mexico, so that was a fun place to train. I then did my spine fellowship training here in Denver at Panorama Orthopedics and Spine Center under Dr. Courtney Brown and Dr. David Donaldson, and they asked me to stay after my year. Not everyone wants to work at a level 1 trauma center. It means working at midnight and sometimes operating through the night. But these can be especially rewarding because these are patients who are coming in very frightened with spinal fractures, and the opportunity to do fairly complex and challenging surgeries and hopefully make a real difference for folks was really appealing for me. And again, it's not terribly common to be at a level 1 trauma center and still have a busy elective degenerative spine surgery practice, and that mix, both here at St. Anthony's Hospital and at Panorama Orthopedics, was really appealing for me. One of the most important things about choosing spine surgery for patients is making sure that you're choosing surgery at the right time, for the right reasons, and choosing the right operation for each patient in order to get the best result. So at Panorama Orthopedics, we have a conference on Monday mornings, and that team approach is my partners and I, along with some of our non-operative spine physicians and our physician assistants, getting together and looking at the x-rays, looking at the MRI, and discussing what operation each one of us would perform for that patient, or even discussing if we would choose surgery for this patient given the symptoms that they have. That approach allows us to make sure that we have a consensus of opinions on the right operation, and especially when we see complex cases. Here at Panorama Orthopedics, we're referred a lot of complex revision surgery from all over the state and even Wyoming and neighboring states. And with these complex surgeries, having the ability to gain multiple opinions really gives us the comfort that we're choosing the right surgery for the right patient at the right time, all of which is crucial to getting successful results. Patients wake up and the nerve pain in their leg or in their arm is gone right away. And that immediate feedback was a nice reward for the hard work in the operating room and the challenge of orthopedic spine surgery. We've been especially fortunate at Panorama Orthopedics to develop an orthopedic specialty hospital, Ortho Colorado Hospital. And all over the state, we see specialty hospitals having lower infection rates for elective orthopedic surgery. But add to that the floor, the nurses, and the care is all specialized towards elective surgery, and it's allowed us to create a better environment with more of a 5-star hotel experience for patients having elective surgery. And the same is true for the surgeon itself. We come in with greater comfort knowing that our staff all know how to take care of orthopedics, and our entire day goes smoother. All the surgeries are more routine, and we truly see better outcomes and fewer complications because this hospital is specialized at taking care of orthopedic surgery.